I'm Frederick Riley, Executive Director of Weave the Social Fabric Project at the Aspen Institute, and I'm really excited to be here today at the Aspen Ideas Health in an off-the-stage chat with Alister Martin, the CEO of A Healthier Democracy and a 2003 Ideas Festival Health Fellow. Welcome, Alister, or do you go by Doctor? You tell me which one you want.
Just Alister.
Just Alister?
Fred.
Okay. Can you tell me a little bit more about your work at A Healthier Democracy and why you believe tapping into the power of healthcare providers can help create positive social change?
Yeah, thank you so much, Fred. First of all, it's a pleasure to be here in this beautiful, scenic environment to discuss ideas and how we can build power together across the healthcare sector. So look, I'm an ER physician first and foremost, and what do I see when I see patients in the ER? Yes, I see strokes and gunshot wounds and heart attacks. But more often than not, what I see is the everyday violence of poverty. I see patients who come to the ER with abdominal pain, not because they have appendicitis, but because they haven't eaten in 3 days.
Yeah, wow.
I see people who come to the ER because it's 2 degrees outside in Boston and they need a place to sleep. Or a young mom of 2 who needs me to write her a work note so she can get back to work and provide for her family. The reason why the healthcare system is broken in these ways is due to a fundamental misalignment in civic representation and civic engagement. We have 60 million people in this country who are not registered, but who are eligible to vote. Wow. That's the entire population of the country of Spain. And many of those people who are unregistered but eligible voters, they're sitting in my waiting room in ERs, in community health centers and FQHCs. And so what we do at A Healthier Democracy is we have a list of programs where we invite patients in to the process of registering to vote right then and there in the waiting room. So they're registered to vote. Many of these patients for the first time right there in the healthcare setting.
What do you say to the folks who don't really see the marriage between civic engagement and healthcare? I definitely see the marriage, but how do you convince the patients, but also the healthcare providers that'll be along the journey with you?
It's a great question. The 3 answers briefly are that, number one, for the healthcare providers out there, at the end of the day, politics influences the care that we can give our patients, period, right? The interventions, the medications we have access to, the procedures we can perform, and this is a very prescient conversation with the fall of Roe. Yeah. They're all dictated by politics. They're all dictated by what somebody who, many times, they have never stepped foot, these legislators, in a healthcare setting or healthcare space. Number 2, every single place you look, every city you look, you find the same exact statistic. Everywhere you look, where voting rates are higher, health outcomes are higher. Wow. Why is that? Well, when communities vote at higher rates, they're pulling in resources into those communities. They're bringing in money. They're bringing in federal programs into those communities that can make them healthier, the community as a whole. And the last thing I'll say is that, look, as an ER doctor, I had a patient recently who came in with an asthma attack, and she was a young Latina woman, short of breath and coughing, and it was very clear that she was having asthma. What we create at A Healthier Democracy are these Healthy Democracy kits, these lanyards and badges which help patients register to vote. Oh, wow. She asked me, hey, doc, why do you have a lanyard that says vote on it? I said, well, because it's important for you to check your voter registration and to make your voice heard. She said, doc, I'm good. I'm not, why bother? And I said to her, well, you see how you have asthma, right? You have asthma at higher rates than every other part of the city of Boston because in your community, you have an airport that's polluting the air. You have asphalt plants and chemical refineries that are polluting the water. As your doctor, I can't take the smog out of the air. I can write you a prescription for your asthma, but the only way we're going to make the community healthier is by you voting. And so we were able to help her get registered to vote for the first time and make her voice heard.
Wow. A lot of my work at the Institute revolves around trust, social trust, and so we follow the trends a lot. And so part of your work is getting trusted people to help the community with messages and all sorts of things. Why do people trust the medical system right now when they aren't trusting any other institutions right now?
I think you're highlighting an incredibly important dynamic that's happening. Not only is there a lack of trust vertically, right? People are not trusting institutions as they did. I think there's also a lack of trust horizontally as well. We're not trusting our neighbor.
Yep, that's right.
Right? We don't believe that the other party has, the best interests of this country in mind anymore. And so we have to go to spaces and places where trust still exists to get things done, I think.
Yeah.
And certainly, I'm not saying that doctors and nurses are the only trusted professions out there, but year after year, they are at the top of the list. And I think the reason why is because there's still something very sacred about the caregiving relationship. And I think you can use that to take advantage of that to do some work upstream at the political and social determinants of health.
Do you see in your field of work that maybe Black and brown communities have a harder time with trust for any system based upon systemic racism and all the things that have happened to Black and brown communities over the years?
I 100% agree with that. And I'll share with you a very interesting finding that just came out of the AAMC, the Association of American Medical Colleges. They just did a study where they surveyed low-income and vulnerable patient groups. And they asked them, what do you think about the process of a hospital registering you to vote? Right? Like how does that land for you? Right? And a really important finding came out of that, and that was for marginalized communities, for low-income, for vulnerable communities, they actually saw a hospital going out of its way to help them register to vote as a trust-building intervention.
Wow.
It's like, oh shit, you care about me like that?
Yeah.
Okay, cool.
Yeah.
So it's just an interesting data point.
Now you have about 4 jobs, right? I don't know. I can't manage my day job, but in your role as a faculty member at Harvard, you're training a new generation of doctors. How are you feeding into the curriculum civic engagement?
That's a really good question. Well, let's start with the facts. So with our work at Vot-ER, we have 700 hospitals across the country that are doing voter registration using our tools and our resources. We have about 100 medical schools across the country that are getting their medical students involved in doing voter registration, civic engagement with their patients. We have 50,000 doctors that wear these lanyards and these badges that register their patients to vote. We've registered almost 100,000 people across the country, across all 50 states plus DC, and these folks have an 85% voter turnout rate, which is 20% higher than the normal. So all that to say, we didn't get there by just waving a magic wand. We had to go in and begin to change culture. Yeah. And the way you change culture, we found, is by starting with the education of a doctor and a nurse and a social worker. And so the way that we integrate it now is we actually have a Healthy Democracy campaign, which is a month-long competition where all of the medical schools across the country compete against each other to see which medical school can register the most voters. And over the course of the last couple of years, schools in Pennsylvania have really run away with it. But we'll see this year. August is Civic Health Month, and so we'll be kicking off the next Healthy Democracy campaign in just a couple months.
Wow. How do you know if you're successful?
Whew. It's a great question. Someone really wise once told me, when you're running a nonprofit, do you want the problem that you are trying to solve to get smaller, right? Or do you want your nonprofit to get bigger? I would like to see the day where we don't need Vot-ER. Okay?
That's a good answer.
Yeah.
That's a good answer.
Yeah, where we don't need to have a whole separate appendage where we are getting people registered to vote in healthcare settings. It should just be the case that you're a citizen so you can vote. Yeah. By the way, every other first world country in this world.
It's the next step in your life.
If you are a citizen of France, you can vote. If you're a citizen of Spain, you can vote. This is the only country that requires its citizens to go and take that extra step of registering to vote. And I leave the viewers with this question: who does that serve? Who does that benefit? And so we have to, as healthcare providers, clean up the mess that is left from these antiquated systems.
Wow. So with all the problems you're wrestling with and all the solutions you're bringing to the table with the work you're doing, what gives you hope for the healthcare space, and what gives you hope for our democracy here in this country?
There's so many things that give me hope. Yeah, there's so many things. So I just spent the last year of my life working down at the White House as a senior advisor in the West Wing Office of Public Engagement, where I ran the healthcare portfolio.
Is that job number 5?
That's right. Well, cat dad is job number 5. This is job number 6. Shout out to my cat dads out there. But no, the really hopeful thing that I found out there was the federal government has literally $80 billion of federal aid programs that goes unspent every single year. These are programs that can pay your rent, pay your phone bill, pay your electricity bill, lower the cost of your of your drugs, your medications. This is money that could be harnessed and channeled into the pockets of whom? My low-income patients who are sitting in the waiting room.
Wow.
And so that's what we're beginning to do with our next initiative at A Healthier Democracy, Link Health. We're channeling this $80 billion in federal aid program funding directly into the pockets of low-income patients to fundamentally change the dynamic, pay their rent, pay their phone bills, pay their heating, electricity bills, and then we can have a conversation with them in 6 months, 9 months about voter registration.
Wow. What amazing work you're doing. There's probably some physicians or some hospital administrators who are watching this and they want to know how they can get involved. They want to know what they can do to help change outcomes and work on civic engagement. How can they get started today?
So the American Medical Association recently passed a new resolution that acknowledges voting as a social determinant of health.
Wow.
We worked with the AMA and stakeholders across the healthcare sector to get that done. And you know, for the healthcare providers, healthcare systems, the healthcare leaders out there that are looking for concrete interventions to answer the question, how do we meaningfully impact the social determinants of health? Or how do we walk the walk on health equity and not just talk the talk?
Yeah.
Help your people vote.
Yeah.
Help your patients vote.
Wow.
Physicians vote at 20% lower rates than the average voter.
Wow.
We need to get physicians voting as well. So that's where I would start.
Wow. Dr. Alister Martin, thank you so much for your time today. Thank you.
Thank you very much, Fred.